we'll go about Marfan Syndrome. It is an inherited disorder that affects the connective tissue. It affects the heart, eyes, blood vessels, and even bones. Many famous personalities like Abraham Lincoln and even Julius Caesar are said to have this Marfan Syndrome. It seems that this weird-looking boy here has it. The general features are tall stature, hypermobility of joints, skinny bones and fingers, and even toes, called as arachnodactyly. He has a large head called gyrocephalic head. It is an autosomal dominant trait, that is, even if a child inherits one chromosome, he will have this syndrome. The type of protein affected here is a protein called fibrillin. It is an extracellular structural protein. We all know elastin is a connective tissue. Elastin is made by a combination of fibrillin plus tropoelastin. Here, the elastin tissue got destroyed. Elastin is made up of an amorphous substance coated by a protein called fibrillins or microfibrils, and these microfibrils are in turn made by a proteoglycans called fibrillins. Fibrillins are generally mediated by FBN1 gene on chromosome number 15. If there is any mutation in FBN1 gene, there will be Marfan syndrome, that is, there will be defect in production of fibrillin protein. So, there will be overall deleterious effect in the connective tissue of the body. Generally, it affects all over the body. In addition to this, when the amount of fibrillin in our body decreases, there will be increasing in a signaling pathway called TGF-beta signaling pathway. Generally, TGF-beta is a proto-oncogene, but now it turns into an oncogene, that is a cancer-causing gene. This is TGF-beta signaling pathway. Here, the transcription mediator is SMAD4, which causes transcription in the nucleus. Now we'll see the overview of what we saw. There is mutation in FBN1 gene located on chromosome number 15. So there is decrease in the number of fibrillins. So there is weakening of connective tissue. So there is excessive activation of TGF-beta signaling pathway. So there is transcription in the nucleus, and thus the deleterious effect results. For information, there are two genes which regulate fibrillin, FBN1 and FBN2. The mutation in FBN1 gene causes Marfan syndrome, but the mutation in FBN2 gene may also be possible. It causes contradactyl arachnodactyly, which is a congenital disease. Now we will see about general signs and symptoms. There is general skeletal abnormalities, ocular changes, and cardiovascular changes. Generally, it affects the whole body, but these changes are major. Coming to bone change, skeletal abnormalities, it includes pectus sectoratum, that is, sternum has gone inwards. As mentioned earlier, arachnodactyly, dilocephalic head are also prominent. Kyphosis, scoliosis are also present. A symptom called aortic dissection. It is a symptom in which middle layer of aortic membrane gets destroyed and blood and fat fills the space. It may even lead to aortic aneurysm, also called as floppy valve. And there is excessive aortic dilation. And other serious symptoms include mitral valve collapse, mitral regurgitation, and other symptoms. There is generally hyperextensibility of thumb. This is the prominent sign of Marfan syndrome. Ocular manifestation, there will be subluxation of lens, that is, since the elastin connective tissue is affected, there is changes in the suspensory ligament of lens. So, the lens move from its original place to some other place, that is called as lens subluxation. Due to this, short-sightedness will occur. It occurs in about 75% of the people, usually as bilateral, symmetrical, and supratemporalic. There is also increased incidence of retinal degeneration and detachment. Axial myopia takes place. These are the general symptoms: subluxation of lens, elongated head, aortic aneurysm, floppy valve, dissecting aortic aneurysm, vertebral deformity, long fingers. Now we will look about the treatment. Generally, there is no treatment, but now we are aiming at reducing heart rate. So, beta blockers are mostly recommended. Blocking of angiotensin 2 type receptors also now preferred. Now, scientists have come up with a new idea of inhibiting of TGF-beta by using specific antibodies. Thank you. Support our work. Love you guys.